Are you ready to simplify your workflow and deliver better patient care? Let's look at expEDIum Office EHR, a cloud-based solution meticulously designed for gastroenterologists, leveraging over a decade of our expertise in providing RCM services tailored to their unique needs. In this video, we'll show you how it can transform your practice. Meet Jane, our front office admin. She begins her day by securely logging into the expEDIum Office EHR. The system's secure two-factor authentication received over an email or cell phone ensures that sensitive data remains protected, enabling staff to access patient records securely over a standard internet browser. After logging in, she accesses the customizable dashboard. For Jane, it highlights her tasks, upcoming appointments, and patient visits for the day. Each team member, whether a nurse, biller, or office manager, sees a dashboard tailored to their role, ensuring easy navigation and efficient workflow. Jane receives a call from Mr. Adams to schedule an appointment. Using the intuitive appointments module, she checks the day's schedule and books his slot. Whether scheduling for new or follow-up patients, the color-coded view helps her efficiently manage appointments across multiple doctors and facilities, keeping the clinic organized. During a call with Mr. Adams, Jane also collects his demographic and insurance information and enters it into this section. She then adds the call log as a journal entry for future reference. Jane then verifies his insurance eligibility prior to the clinic visit. Seamlessly integrated with expEDIum medical billing software, this process is streamlined and secure, helping the clinic manage billing more efficiently. Once Mr. Adams arrives for a consultation, Jane collects his insurance card and lab results, completes the consent forms, and seamlessly scans and uploads the documents into the document manager. Categorizing them into silos, she ensures they are digitally organized and securely stored on the cloud, eliminating any need for local storage. This streamlined process makes the documents easily accessible to the care team. Next, Sarah, the nurse, prepares for Mr. Adams' consultation. She records details such as social history, surgical history, medications, allergies, problem list, and family history. This patient information is automatically reflected in the visit note, thus saving time during the consultation and follow-up visits. Dr. Roy, the physician, begins the consultation by reviewing Mr. Adams' pre-populated details in the visit note. With a clear and complete view of the patient's medical history, Dr. Roy documents his findings using the customized visit note template supported by features such as a visit dictionary with the clinic's vocabulary and speech-to-text SOAP section converter. After assessing Mr. Adams, Dr. Roy prescribes medications using the seamlessly integrated NewCrop ERX and EPCS system, which is Drummond certified. He also documents the diagnosis and procedure codes and schedules a follow-up visit if necessary. This information will be used when submitting MIPS reports. Before leaving, Mr. Adams receives a digital summary of his visit, including prescriptions and follow-up instructions. This streamlined process ensures he is informed and prepared for the next steps in his care. In the billing office, the team creates an electronic super bill based on Mr. Adams' visit note. The seamless integration with expEDIum medical billing software streamlines claim generation, enables automatic electronic claim submission, and ensures smooth cash flow and reimbursements. The effortless login from EHR to EMB further enhances efficiency in managing the medical billing workflow, including claim scrubbing, claim denial management, and access to claim history. Next, with the patient ledger from expEDIum medical billing software, the billing team tracks all payments and charges, ensuring clear and accurate financial records. Task management is simplified with expEDIum Office EHR. The color-coded system helps the team prioritize tasks efficiently, ensuring that clinic operations run smoothly every day. Tom, the clinic administrator, tailors the EHR to the clinic's specific needs with the help of expEDIum's implementation and support team. From creating user roles to setting up custom fields, the system adapts seamlessly to different workflows, ensuring each staff member can perform their role effectively. Additionally, we support data migration from existing EHR software, seamlessly transferring appointments, patient demographics, and documents, ensuring a smooth transition. With the reporting module, the administrator can also generate detailed insights into patient care and clinic performance, enabling data-driven decision-making. Need help? The Help section provides detailed guides and FAQs, ensuring that all users, whether at the front desk, nursing station, or billing office, can easily find answers to their questions. The product's intuitive design also includes easy navigation and an app drawer. It features a quick search option using name and MRN to open patient chart, provides direct access to tasks and notifications from any screen, thereby providing a smooth workflow. Developed with user feedback and refined through extensive testing, the UI/UX design system supports every aspect of clinic management. Visit our website to sign up, learn more, and stay updated on the latest developments. Be among the first to experience expEDIum Office EHR, launching in Q1 2025. Reach out to us at contactus@expedium.net 7866460099.